Welcome to Talk South Asian to Me Season 2. My name is Michelle.
And my name is Anusha. Tune in every Thursday at 5 p.m. Central and hear us react to each other's stories about mental health and growing up in different South Asian households.
And remember, this podcast is not therapy. Engage with what feels entertaining and resonates with you and leave what doesn't. Okay, we are on letter X. And as you know, when I was telling you, it was really hard to find this topic. And so we tried to do a little play on words. Okay, so our topic for today is expectations during childhood. Expectations. You get it?
Expectations.
Yes,
It works.
expectations. So I know in our first season we talk about which is our letter C childhood blueprint, where we talk about parenting styles, but this is more hone in and focus in on expectations for children during their childhood. So I have multiple sources that I use. I use Psychology Today, at the American Psychological Association, the Melbourne Child Psychology website. So I have a few of those resources that I used for some background, and then we'll get into like the South Asian kind of spice addition to it as well.
Mm-hmm.
So the definition of expectations is expectations are strong beliefs that something will happen or be the case in the future. It's a strong belief. Parents have what'd you say?
It's like a hope.
Yes, it's a hope. It's a vision. It's strong. Hope. Yeah. Emphasize strong. Yes. Parents have expectations that can be harmful and cause the child to feel shameful, or they can also be helpful, right? So expectations kind of has two sides. It can be harmful and cause a child to feel like internalized feelings like shame, anxiety, but it can also be helpful with the right balance and benefit the child's development of their abilities. So all of this, whichever way the scale is tipped, it depends on the parent's attunement to their child's unique interest, tendencies, and temperament. That's the key, is how much is the parent paying attention to what interests the child, what makes the child happy, what's their temperament. And I want to point out that it's very natural and very easy for parents to have expectations, right? It's just a natural human phenomenon. Everybody has expectations. It's just a natural human thing to do, right? Especially with children, when a child is born into a household, or even before they're born, like as soon as a parent find out the sex of the baby, like they start kind of envisioning their life or creating their hopes and dreams, right? It's positive, right? So I'm going to one of the sources I researched breaks down expectations and when it can be helpful, but also when it can be harmful. So let's go into the helpful piece first. So how are expectations helpful during a child's childhood, right? Upbringing. Mm-hmm. So expectations communicate to children that what they do matter and that they matter to us, right? What their actions are, their behaviors are important, right? This gives children a profound sense of belonging. Our hopes for their future are linked to our hopes for our own future, right? They can also encourage children's development, right? For example, like developmental milestones, like cognitive developmental milestones or physical milestones, like learning to crawl, learning to stand, learning to walk, right? If parents have expectations for their children to attain these developmental milestones, then they are in an environment that's facilitated, right? So when expectations are realistic, they are healthy, right? When they're realistic. And I'll get into a little bit more of that as well. Just how else a parent can have helpful or realistic expectations. But I wanted to switch gears and go into the harmful piece. So parental expectations are harmful when they are not based in our attunement to our children. When our fantasies about our children do not coincide with their interests, talents, and tendencies, our expectations can strike a blow to our children's development. When parental expectations are not met and parents feel disappointed, their children internalize a sense of themselves as being a disappointment.
That's good.
Internalization starts pretty early, and I think that's something that I would say a lot of people have misconceptions about. Oh, like there's just a child, they won't remember this in the future, or they don't, like this doesn't affect them, but it does, right? Internalization starts pretty early on. So when what is expected is not among the child's talents, parental disappointment can be devastating. For example, a child with no musical talent who is expected to excel at it, right? At being a musician, they will develop a low sense of self-esteem, right?
Mm-hmm.
If they don't have any talent or they're not interested in music, but their parents expect them to excel at it, then they can have that low self-esteem developed internally, right? When the expectations of the parents directly contradict how children experience themselves, children may hide parts of their identity. And they assume a false identity in order to appear to conform to their parents' expectations. So, for example, lesbian or gay children who are expected to be heterosexual or conform to traditional gender roles may find themselves denying this fundamental part of themselves for the sake of parental approval. These children grow up with a deep sense of shame at their very core.
It's so funny that that's literally the example you gave, because I was literally thinking of a client. That is exactly what we've been working on. We're working on. Yeah.
And it's sad. Like, it's so true. I feel like we'll get into this when we go into like talking about the South Asian community too. But I think it's really important to point out that in our community, especially, this is very common, right? Children don't feel safe or comfortable to be themselves, whether that's, about their identity or even like their wants, likes, interests, talents, right? They sometimes have to go behind their parents' backs.
Yeah. And I think there's also this element of I have to go behind their back because what I want is bad. Like maybe even an internalization that it is bad. Or, for those that don't feel like it's bad but know that it's just different, it's like just gotta keep the peace.
Right.
Right. And then there's this another element, another layer of obligation, right? I feel obligated to be hiding this part of myself because they've done so much for me. This is the least I can do for them. But those kinds of things never last because we can do little, small, tiny sacrifices, compromises. We cannot sacrifice big things for us. It never goes that way. It never ends up that way.
Exactly. I think you nailed it. And we're going to you're foreshadowing a little bit what we're going to talk about when it comes to the South Asian piece. I love it. So kind of going further into the background, I wanted to talk about some research and some connections. So research shows that rising parental expectations is linked to perfectionism in college students. Perfectionism contributes to many psychological conditions, like we've talked about in our episode about perfectionism, right? That includes depression, anxiety, self-harm, eating disorders. Young people internalize those expectations that their parents might have, right? And depend on them for their self-esteem. And when they fail to meet them, as they, might, they'll be critical of themselves for not matching up. And to compensate, they strive to be perfect. So parents can help their children navigate societal pressures in a healthy way by teaching them that failure or imperfection is normal and a natural part of life. A quote from one of the articles was that focusing on learning and development, not test scores or social media, helps children develop healthy self-esteem, which doesn't depend on others' validation or external metrics. So what are some ways that caregivers or parents can set high expectations? Because we talked about, right? Expectations are so important, right? They help children feel like, accomplished. They help children feel like they've achieved something. They help children feel a sense of belonging, right? They also help children work towards achieving their developmental milestones, right? How can parents or caregivers set high expectations without high pressure? That's the key, right? How can these high expectations still be in place without these children feeling like they're under pressure and under high pressure? So expectations can spill over into pressure when they are inflexible, unrealistic, or inadequately supported, right? Those are the things that can make expectations become high pressure. So one, a parent or caregiver can adopt a growth mindset, right? Two, they can make expectations clear, realistic, reasonable. Those are big ones, right? Set achievable, SMART goals. Set achievable expectations for your kids and make sure they know exactly what they are and how you expect them to achieve them. For example, I expect you to study for at least 1 hour a day. right? But an unclear, high pressure, and like the opposite of that is I expect you to get a 99 on this exam, right? That's not realistic expectation.
Focuses on
Teaching
the lesson.
action. Yeah, action. Yeah. The third tip is aim for personal best and fulfilled potential, right? Instead of like the external metrics, kind of focus on like the hard work, like you said, like how much potential the child has, and make them feel good about them, like putting the work in, putting the time in, right? They're doing
This
their
is
best.
also like, as soon as you said that, what I heard was compete with yourself, beat your past self, right? Like we have such a tendency to compete with other people, but like, is it apples to oranges? It's not apples to orange. I mean, what am I saying? It is apples to oranges. So it's not a fair comparison. But if you're comparing with yourself, that's fair. That's an accurate measure of your progress. But you against somebody else is not an accurate measure of your progress.
Right. Exactly.
These are good examples.
I know, I really liked them when I read it. I was like, this is such a good way, a concrete way to explain it. So the fourth tip is let them make mistakes. It's really easy for a parent or caregiver to correct the mistakes right away. Be like, no, you have to do it this way, not this way. But like, that's how children learn. They learn by making mistakes. And I think that's really important to think about that, right? Like, especially, and I'll get into this in my story too, but again, that idea of perfectionism, like so many adults in today's world, not just in the South Asian community, they expect their children to act like adults, be perfect, but they're children. They learn about the world they learn and live through the world through mistakes. And so it's important to let them make them and make it normal.
Story too. Same Z's.
Love it. And then the last tip is, this is a really important one. I think my favorite one is offer support and encouragement through the process. That warmth is really important, right? Continuous support, continuous encouragement, I think, is the key as well, right? You can have high expectations, but if there's no support, there's no encouragement, then that might also perpetuate the feelings of low self-esteem and anxiety if that child fails or makes mistakes. So that was kind of like the general background of expectations during childhood. Do you have any like thoughts, anything you wanted to add, or anything you were surprised by?
But I did really enjoy hearing, these specific examples of what that can look like and how to like foster healthy expectations. Because I mean, as humans, it's natural to have expectations.
Right.
We're not going to not have expectations. Expectations aren't the problem. It's being too attached to an expectation, especially if you consider that it doesn't serve that person, doesn't benefit that person. It's only about you and your hopes.
Exactly.
Right? That's where we deviate a little bit. Usually adult children tend to feel that they're going to let people down and like, my parents expect this. I feel obligated to fulfill. It's normal for your parents to have these expectations. It's okay that they have the expectation. And I always say, like, don't you have expectations that have been dashed in the past? And I'm sure you felt disappointed, but did you hold that against them? Did that make you not want to continue to love them and have a relationship with them? And like, depending on what it is, usually the answer is no.
Yeah.
I think that perspective taking for these expectations are really important.
I think as parents and caregivers, it's easy to get lost in your own expectations and let that cloud your judgment or like how you respond to the mistakes, right? So it's important, like you said, to like remove and be more self-aware. Like, okay, this is what I want, but is this what the child really wants or no?
Is that what benefits them?
Exactly. So going into the South Asian piece now, I will be referencing a couple of sources. One is from Psychology Today called South Asian Parents and Their Expectations by Joitsna. Sincere apologies if I'm not saying this name correctly, but it's Joitsna S. Bhatt. And then another article an article from Detroit Writing Room called Emotional Manipulation and Expectations in South Asian Households. And then another article from Solidarity Therapy called Navigating Identity, the Challenges Being a Child of South Asian Immigrants. And then lastly, another article called The South Asian Family Trap. Okay, so the first thing I wanted to talk about was some quotes from one of the articles. Kind of talks about expectations that South Asian parents tend to have, right? in that dynamic of being in that South Asian household. So pleasing parents and respecting their wishes is a value of collectivist communities that can be admirable and honorable in some cases. But in others, it can lead to devastating circumstances. Many expectations in the diaspora are fueled by factors of gender, sexism, religion, or cultural ideologies. These extend into familial duties, gender roles, career choices, marriage, and family planning. So the author of this article kind of continues and shares quotes from people that have shared, receiving this high pressure in their families. So one of these quotes is about family duties and gender roles. So a parent said, "We will be very disappointed if you don't follow what we are saying. We know what's best for you." Mm. Right? There are many age and gender-based expectations in South Asian families, right? For example, sons who especially the oldest ones are expected to handle the finances and be the source of strength and sanctuary, right? But on the other hand, like daughters are not are expected to stay at home and kind of take care of the home and those duties. So that's one example. Another one is kind of the expectation for daughters or like just daughters in the family to be the caretaker of the family, right? So this quote is, "Lalita auntie's daughter visits every week, and you can't even do this one thing for me." Right? Again, that expectation is, yeah, right, right. And this is one quote, but it could be representative so much out there. I feel like I've heard this myself, like it's these expectations are really well rooted, in this community and these communities and these families. And I could say that for my family too, where conversations and behaviors are fueled by them. And sometimes things that are said or done can be hurtful.
I want to pause you right there. So I just want to talk about how, like, sometimes, I say sometimes because this is not always the case, right? But sometimes parents who are coming from a place of love and care still do this. Like you said, you have experienced this. I know I've experienced this, but it's not because my parents are trying to be mean. It's not that your parents are trying to be mean. They're coming from a place of love. But instead of saying, "Hey, I miss you. I want you to come home more often so I can see you, so I can, feed you food and show you my love." Instead, what they say is, "You see this person and what they do? Why can't you do that?"
Right.
Like they're trying to communicate that love, but it falls flat. And instead, what we end up receiving is not love, but a comparison, a shame, a guilt.
It's kind of misconstrued. Like it's miscommunicated. Like, even like I agree with you. Like it's very well, and it could be very well intentioned, and most of the time it is. It just doesn't come off that way.
No, right? And that doesn't take away from how it is executed and what we do feel.
The impact, yeah.
But when we can understand that, at least we have a little bit more of like an empowered feeling of, oh, I don't need to be guilted by this. I don't need to be shamed by this. What are they really trying to say here? Exactly. Almost like it can be a little bit empowering to reframe that understanding. For some people.
Yeah, exactly. I agree. Some more excerpts are South Asian parents tend to use emotional manipulation to control their child's behavior to their liking, right? Some examples include, like, again, could be well-intentional, right? Like they think that whatever their child's behavior is not right. So they want to make sure they bring their child back on the right track. I feel like I hear that a lot. And so I'm going to use emotional manipulation to control them. So some examples are like guilting them or giving them an ultimatum, right? A United Kingdom study referenced in the Mental Health and Stress Among South Asians, which was an article published in the Journal of Immigrant and Minority Health, showed that middle-aged Pakistani men and older Indian and Pakistani women reported significantly higher rates of depression and anxiety compared to white people of a similar age, while also factoring in people's social and financial backgrounds. Yeah. And this study is rooted in like the expectations that are set for these people. So it sounds like, as a society and as a culture, is just something, again, it's these ideologies of this culture, right? Which is collectivism, right? Parents know best. So we're going to tell you what you need to do. These are our expectations. And if you don't meet these expectations or if you don't follow them, you might we might make you feel shameful, or, you might be shunned, right? Like it could be so many different things.
Fear is also really like contagious, right? You don't know what is going to happen. Am I going to get cut off? Am I going to
Yeah.
lose this relationship? Whatever.
Yeah. And like, parents do, right? Caregivers, they make elaborate plans to give their children the best lives that they think that child deserves, right? It's out of love, you said.
Yeah.
But as a result, because of these children, they become vessels that carry the unfulfilled desires of the child within them, right? So
Perfectly
that's like
said.
another thing about like immigration, right? Like
Mhm.
sometimes the child is living the dreams of the parent, even
Mhm.
though
It's not
that
their.
dream might not align with the child's dream,
Mhm.
right? So, any South Asian child's eyes, especially the eldest or single child, will show the fear of disappointing their parents, like you said, because they know how much their parents have done for them, they've sacrificed, right? The emotions have molded their existence, and we grow up believing that any deviation from this plan that the parents have for us can result in a lifetime of heartbreak. So there's no room to make a mistake. So, that's something to think about too, is just like there's just so much guilt that's deeply rooted from deviating from parental and caregiver expectations. And I kind of wanted to kind of quickly brush over like a child of South Asian immigrants, because that's again a big common dynamic, right? Especially that biculturalism that we've talked about in the past too, is when you are a child of South Asian immigrants, it can be sometimes really difficult navigating the expectations that your parents have for you, but also the expectations that Western society has for you, or you're in your school with your friends. So some of the challenges that a child can face when they're navigating these two identities, these two sets of expectations, is the cultural identity, right? Balancing the respect for elders in their family, South Asian family, but also trying to fit into the Western society. And they might contradict, right? The pressure to succeed, the pressure to excel academically, pressure to excel professionally, that can lead to high levels of stress and anxiety, and they can feel that weight of parents' expectations, right? There could be strained generational dynamics in those types of households, right? With children with South Asian immigrants, that children may feel torn between honoring their parents' traditions, but also carving out their own path in society that promotes self-expression and individualism.
It's a struggle.
It is, but it's there, and I think it's so important for parents and future parents and caregivers to really become aware, what will my expectations be, and how am I going to separate that from what my child wants? I think that's really important. I think I'm going to go into this semester, and I'm about to start too. Like, this not only has to do with parents and caregivers, I think the parentified eldest siblings can make an impact too on the younger siblings of how these expectations play out. Mm-hmm. I think that can play a role too, in my opinion.
Mm-hmm.
Mm-hmm.
Usually the eldest daughter, but also the eldest son, they're parentified, right? And they do kind of act as third parents. So it's another way that whatever you took in and internalized, you also pass down in a way too.
Yeah.
Yeah.
Yeah. So that was kind of my research. Are you ready for story time?
I am. I love this topic. I'm
It's a
ready for
good
your
one.
story.
Okay. So I feel that when I was reflecting on this for myself, expectations, like we talked about, is so broad, can be very tricky, right? How you look at it. But, the way I viewed it was that, on one hand, parents' expectations, like we talked about, is out of love and good intentions. But how they are developed and enforced can be harmful and have the long-term impact on the child's mental health, right? Like research says that pressure, unrealistic expectations during childhood can lead to perfectionism during adulthood. And parents want the best for their children, but sometimes what they think is the best is not always what is actually best for their children. So that was kind of like an intro to my story. I'm going to split it into two parts. I'm going to kind of talk about my personal reflection, but I'm also going to talk about maybe me sometimes being on the other side and being guilty of like being that parentified daughter and enforcing those harsh and high pressure expectations. So starting with me first, I watched this unfold in my household growing up. My sister was always compared to me and my achievements. I did not like that. The expectations my parents had for my sister were unrealistic and they were not encouraging. They were not supportive. They were always just going on and on and on. What is she doing? And what is she's not achieving? This was something on me too. Like, what am I not doing right? What I didn't say something right. I didn't act right. I didn't behave well. Like, there was no support. It was just kind of like more nagging. Again, well-intentioned, but was very negatively impacted by it. I would say that really conditioned me to strive for perfectionism. I know I've talked about this. This is something that I've been dealing with till today, of like how I'm still sometimes striving for perfectionism, even though that's not something that's realistic or unattainable. But those were types of the expectations that were held for me at home, or the positive attention I received was my, almost close to perfectionism behaviors, right? So I think, thinking about my childhood and me growing up with my sister, we're 5 years apart. So I'm 5 years, like my sister was born when I was 5, and I kind of was very excited that she was coming into the family. Like, I always wanted a little sibling. She kind of became like my best friend, but also someone I would enjoy taking care of and helping my mom take care of. I really took on the role of being that parentified daughter very naturally in a way. I feel like I already just had a nurturing nature. And so I was very attached to her. I wanted to like, give her baths. I mean, there was one point where we were so little, we would take baths together, but I would take care of her first, then myself. Or I would make sure she has food. Like both my parents were working at that time during our childhood. So I was kind of being the one like taking care of her, making sure she's taking her medicine, she has food. When we go to prayers, she would sit with me and not my mom. Like, I would distract her during prayers or keep her calm. So I really took on that parentified daughter role very seriously, but also like very unknowingly. Like, I just did it. And I would say, I think my parents modeling, setting those unrealistic expectations or not giving the space to my sister to make mistakes, I kind of adopted that as well. Like, I became almost that helicopter second mom, where I wanted her to go to the best school, the best college. I was pushing her to like make a schedule for her essays, make a schedule for her college applications, make sure she's like reaching each deadline. Like, instead of letting her figure out what she wants and how she can organize her, efforts and how she can achieve those goals, like, I was telling her what to do. Like, I wasn't giving her the space to make mistakes. I wasn't giving her the space to think critically and figure out and problem solve like what she can do to help herself. And that became pretty like standard, I would say, like until she went into college. And I remember like she was struggling with her mental health a little bit while she was in college. And again, even though I was like long distance, she was all the way in New York, I was in Texas, thousands of miles away from each other. Probably not thousands, but like a lot. Don't know my geography. Can't think right now about geography, but yes, but very far away. And I took the responsibility of like creating like not a treatment plan, but like a motivation plan for her to like overcome her mental health. Like, I didn't even ask her, like, I just created a reward system, told her to follow this, and this is how she's going to get rewarded. This is what motivates her, like almost as in like a behavioral like support system to like help her. Like, I took on the responsibility of that without even like,
I'm sure she really
getting her. Yes, so she enjoyed it.
Oh, she actually did. I was being sarcastic.
No, she agreed, and she was like, okay, I'm going to do this. But
awesome.
but there's a catch.
No.
She didn't take it seriously because she wasn't involved in it. So like, I love her. If you're listening, I love you. I'm not saying this in a bad way, but this is the truth. She like was not fully telling the truth of her like accomplishments and how much progress she was making. So my parents were like, they were following the reward system thinking she was making progress, but she wasn't. She was not being truthful. Sure. And as soon as I found that out, it was like a reality check. Like, oh, like maybe my expectations as her older sister and maybe quote unquote second mom is not realistic for her, and she can't achieve this because she's not at that place, or she's not as involved when she should be. Like, why am I kind of laying out the steps for her when she should be doing that? And so that was like a quick, like a really like slap in the face, like, oh, I need to take a step back. Like she needs to grow, like, I need her to grow up and figure this out on her own. And that's something I like worked on in therapy too, is like, how do I step away from being her second mom and just be her older sister? And that was really hard. And even like today, I want to analyze her relationships. I want to tell her, like, no, this is what they're doing wrong or this is what they're doing right. But now I'm like being really intentional and just listening to her and being a listening ear and let her come to those conclusions. Even though it's not the same time frame I want her to, but she is. She is getting to those conclusions. So like I think this is such a good example of like you want your children to be like at a certain point in their lives, like because that's what maybe research says or metrics say, what are external things, but maybe that's not what's best for them. That's not what they need. They need to figure it out on their own. I think that was like really hard for me to accept as her older sister. It's like she's her own person. I need to stop having I can have high expectations for her and set boundaries, but I can also respect her, the space she needs to figure out and achieve those expectations, right?
Or not fulfill your expectations even.
Her own like set her own expectations. Yeah. So that was a little bit of like, my reflection of like me being in that role, even though I'm not a parent, but I feel like I had that parentified role where I am guilty of like maybe perpetuating her not feeling like she's competent or she's able to do things her own. And that was also modeled by my parents. So I just followed suit. And so now she's like, just now, like she's really focusing on being independent. She has a job, she's managing her own doctor's appointments. Like she's doing everything by herself. And I'm just so proud of her. And I don't think she would be able to do that if my parents and I didn't give her that space to do it and figure out on her own. And, when I working as like kind of flipping it back to my work, in my work as a child life specialist, working in a hospital, in an oncology outpatient clinic where I'm working with a lot of patients long term, like I'm seeing them a lot, I notice this with parents as well, right? When a parent undergoes a traumatic experience, whether that's immigration or intergenerational trauma or finding out that your child has cancer, I notice that sometimes this high pressure, unrealistic expectations they set for their children is a trauma response and their coping mechanism, right? Like they want to want their best for their child, or they want their child to just do what they are asked to do or kind of meet those high expectations, whether that's an immigrant parent wanting their child to be a doctor or a lawyer or an engineer, right? Like even though that doesn't align with whatever the child wants. So even in the healthcare settings, I see that parents are setting these high expectations for their children that are sometimes unrealistic, but that's their coping mechanism, right?
Fear-based.
Do
you see that? Like some of these,
yeah, I think it's fear-based. Yeah, I think it's especially with like the rules, like in leukemia, the patients are very immunocompromised, so they can't go to school, like they can't, they can't do a lot of things. And so it's a stressor for the patient, but also the family. But if the patient is like making a mistake or, having a hard time coping themselves and like having a meltdown or a tantrum, like just because they're regressing and they're going through all these hospital related stressors that are affecting their development and their coping, sometimes the parents' expectations even get more stricter just because they're having a hard time tolerating those changes in their child. And so there have been many times where I've noticed this, and sometimes there's just no encouragement or warmth. And that could be, again, fear-based or like a protective factor for that parent. Like, I'm teaching my child to like wash their hands every time they touch a surface, right? Like sometimes they get so fixated on that. And if the child doesn't follow that high, unrealistic expectation, they get upset, right? So when it comes to like how to, like as a child life specialist, I'm not directly like giving advice to parents, but sometimes they seek advice. I'm just like modeling how I set expectations for my patients, because I do have to set expectations for my patients, right? How they cope, how they follow instructions in the clinic, how they, comply with what the nurses and the staff need to do for your treatments, right? And so I'm always pairing these high but realistic expectations with lots of warmth and excitement and praise when the expectations are met. And so one parent I remember very distinctly is that I remember like during procedures like the port access, like pokes, that child had a really hard time in the beginning coping with the port access. Like this was a school-age child, like, tall, needed multiple staff members to hold this patient down to be able to complete the procedure. It was pretty traumatic. And, I worked really closely with his family to come up with a plan to like decrease the number of staff. Like he was motivated by science experiments. And so I made sure to like, be consistent with that plan. But I noticed it's just that parent was just so upset about what's happening and traumatized by all that parent would forget or would not praise the child when they were meeting the expectations and practicing positive coping strategies. And so I remember like when the patient started becoming more successful, more independent, followed instruction, didn't need extra people, like I would get really excited right after, like, oh my gosh, you earned your science experiment. I'm so proud of you. You held still. Like you only used your one break, your 1 30-second break. Like you didn't do this. And like, I just kept on doing that consistently. And then that parent started doing it herself naturally, which was such a big win to see. Right? Like that warmth and that encouragement with that expectation was missing. And if, again, like we talked about in the research, when that warmth is not there, that can again be related to low self-esteem or, lack of confidence. So that was something that was really great. And I tried to do that at work.
I'm so glad that, you incorporated like your work into this, because I mean, that's really wonderful, like wealth of resources and knowledge and insights that you have about exactly how these expectations, how they look like how they look like and impact kids.
Yeah, that's my story.
I have a question for you though.
Okay.
I held it in. I was like, I don't know if I'm going to remember this question, but we'll see. My question for you is, when you saw yourself as being more of a second mom versus when you started to kind of let that expectation go and allow yourself to be, her older sister, what was that experience like for you to transition that way out of
It was
that?
very freeing. It was like, I know we hear this phrase a lot, but I literally felt like a whole burden was lifted off of me. And I remember, I think I probably had mentioned this in a previous episode, but like I really made that change by having a conversation with my sister. And I kind of told her, I love you. I'm your older sister and I'm done being your second mom. And she like laughed at it, but she like was very receptive and she's like, I hear you and that sounds good. Like, and it's almost as if she appreciated that. Like she needed that. Like I can't imagine how suffocating it might have felt, right? Like these two moms basically hovering over her every action, making sure she's taking care of her health, her mental health, her academics, her professional life. That's a lot. It's a lot of pressure, a lot of high pressure, which definitely had a negative impact on her mental health. And so I think that freeing feeling was not only just for me, but for her. But for me personally, I think it was just very freeing and almost made me be a better older sister, helped me set better boundaries for myself. Like I would tell her, like, I will look over your resume, I will do interview prep with you, but you have to tell me you need it, or you have to reach out and schedule that with me. Instead of saying like, hey, your interview's coming up, let's do a mock interview. When are you free? Or hey, you're about to apply to this job, let me look over your resume. Right? Giving the control in her hands instead of mine.
You let her drive. You shifted everything.
And it's so funny. Like at first she was like, I don't like this. I was like, I know you don't like this because you're so used to things being handed to you and being done for you. Sure. But like, that's not realistic, And so now I'm actually working on, as her older sister, having high expectations as her older sister, but also giving her the space to figure out what those are and like helping her figure out what her own expectations are, but then holding them to her, but then also being warm and encouraging if things fail or things don't work out the way she wanted them to, removing myself from it.
Thanks for sharing that. Yeah, I asked specifically because that's exactly what I was curious about. Like, was it liberating or was it really, really like just too hard? I mean, I'm sure it was hard.
Yeah.
Any transition like that over decades of habits to undo is hard.
Yeah, at first it was hard.
Right? It's ultimately liberating. And I mean, I think that's so important to recognize because almost like expectations are normal. As humans, as we live and breathe, we are going to naturally have some hopes, expectations. Yeah. That's so normal. But this felt so liberating liberating to you, I would imagine, because not only did you have these expectations, but almost like you took on that responsibility of making sure those expectations came true.
Mm-hmm.
Right? Would you agree with that?
Yeah, I agree. Yeah.
Yeah. But that's the hard part, right? We don't actually have control over anybody's life, right?
Mm-hmm.
We really just
Mm-hmm.
don't. So
We
having
don't.
that expectation of this would be good for them, I'm going to need to take responsibility to make sure that that happens, is like a fool's errand. It's impossible. It's just not going to happen because we don't have
Mm-hmm.
control over other people. And so sometimes it can feel like a huge weight, a huge burden. It can feel frustrating. It can be
Yeah.
like, I know what this is going to be so good for you. Just come on, please do it. Right?
Yeah.
But if we release that, if we relinquish that, and we just kind of see it as, this is what I know you deserve. This is what I would love for you to have. Is that what you
Mm-hmm.
want? We release kind of that
Mm-hmm.
responsibility of, I think you are more than capable of having that if you
Mm-hmm.
want that. And if you need
Mm-hmm.
help, if you need support, I'm here for you.
Yeah.
That's so much more liberating. And that's so much more
Mm-hmm.
like, I don't know, just peaceful.
Mm-hmm.
Just so
No, it
right.
is very peaceful.
Yeah.
Like, I've had multiple conversations like this, like, oh, like, I believe that you're capable of doing this,
Yeah.
but it's ultimately up to you. And I'm here
Right.
to help you get there if you want.
Yeah.
Mm-hmm.
Exactly. Thanks for sharing that. We
Yes,
should
of
also, I
course.
should like message Anaya and be like, thank you for being a part of this.
Right.
Unintentionally.
I know, I know. She's pretty open, so I appreciate her like letting me share our stories.
Okay, ready for mine?
Yes, I'm ready.
I took a little bit of a different take on it, which I think is great. I'm taking more of a,
Ooh.
this is the expectations that I have witnessed as a child, and this is the expectations I see other parents giving to their children. So this is more just
Mm.
observational stuff,
Okay,
literally more from a child's perspective. So
love it.
the first thing that comes to mind, like when I thought of this, that phrase, be seen, not heard until spoken to,
Mm.
right? And obviously nobody ever said that to me. Nobody was ever that mean and said, you're just going to be
A
seen.
child.
No words
Yeah.
from you. Like it wasn't
Mm-hmm.
like verbalized like that. But that's what I think of now as an adult. That's exactly what I think of based on what was said. For example, things like anytime I was with family, like even just like in the random weekday, like with my mom or just anybody, they would always say like, come sit next to me and do your thing. Just come sit next to me. It's fine.
Mm-hmm.
And like they might engage me for a little bit on like a conversation. How was your day? What did you
Mm-hmm.
do? What are you up to lately? And then it's like, okay, just sit here though. Sit here. And then they're going to talk to somebody else.
Mm.
Right. So it's almost like this subliminal messaging of like, I want to have my eyes on you, but like there's somebody else I need to talk to. There's
Mm.
somebody else that needs my attention.
Yeah.
I feel like this can also come out in things like parties, maybe get-togethers, maybe when it's like at your place and it's like a casual one. It's not like a legit party, but like if somebody's visiting you,
Mm-hmm.
I don't know if you've had this, but I was never allowed to be in my room. It's like, unless there's an exam and I'm studying, if somebody's
Yeah.
visiting, it's like, come downstairs, come say hello, come sit with them, even if you have nothing to say to them,
Mm-hmm.
even if you don't know them,
Mm-hmm.
just come listen to their stories, just come sit down here.
Yeah.
It was like you had to be almost like presented to them. You had to be
Yeah.
showing up as like a family unit. You couldn't be doing your own thing if you were in the house.
Yeah.
You couldn't be in your bedroom doing whatever, unless you were studying for an
Mm-hmm.
exam. And even then, it's like, no, come say hi. But who are these people? I don't know who these people are.
Yeah.
Yeah, and like also, I don't know if you've heard this, but like I cannot tell you the number of times I've heard in my childhood, this is not a topic for kids. You're too young to understand this.
Mm. So
Right? So
much.
right, yeah. And I don't know about you, but what that teaches me is everybody wants to see me, but no one wants to hear from me.
Mm-hmm.
I'm too young to understand adults having conversations. I'm too much of a child, and these conversations are just simply not appropriate. And like, I mean, sure, there are genuinely things that are not appropriate, but is everything off the table? I don't think so. That's a matter of perspective, right? As far as behavior, though, I have so much to talk about in terms of behavior.
Mm.
I think what is most evident to me in terms of the expectations for children in terms of behavior is like just to know what is and is not appropriate, just to
Yeah.
know what you should and should not ask for, just to know how to be calm, how to play quietly, just to know how to use your words and not have like a temper tantrum.
Yeah.
And just to know and do better when you make mistakes. Like you dropped a milk on accident. there's no room for that. Why would you drop a milk? Shouldn't you know better? What the hell are you doing? Like yelling, and like maybe even getting hit, and basically expecting you to be a fully grown adult as a child.
Yeah, exactly.
Right? But that's just so unrealistic.
Very.
And I mean, let's be honest, right? How many adults can you think of? I can think of plenty of adults who act like children, right? Like they themselves drop things on accident. Nobody's yelling at them for it. I can think of plenty of adults who have adult temper tantrums. That's what I like to call them. Where they yell. They don't use their calm voice, where they might even throw things. What about them?
Yeah.
Right? Like, what does it mean when people are like, you should just know and you should act like this and you should be like, where is that coming from? That's not coming from that is what is needed, but rather that's what the parent wants to feel comfortable. That's what the parent wants to feel in control.
Right.
It has nothing to do with the kids.
Exactly.
And I think when that kind of stuff happens, though, I think it's so easy for a lot of people to just like forget how kids need to be molded. They don't just know things. And depending on their developmental stages too, they can or maybe cannot yet grasp the things that you're trying to demonstrate to them, model to them. But that's the other piece, right? Sometimes it's like, do as I say, not as I do. Kids learn a lot from what you model, from things you don't even think that you are imparting to them, but they're silently watching you and learning based on what you're doing. And you might never have expected them to learn that. You might have never said anything verbally to them, but they're still learning that, right? So the things that you say and the things that you do, things that you model consciously or while you think they're not watching, they have such a great impact, right?
They do.
And I just feel like other than that piece too, there's also this piece of like enforcing the expectations consistently, right? Like for example, it happens, we're humans. But if we tell our kid like, okay, you're having a temper tantrum right now, fine, we don't have to go out of the house right now. I'll wait until you're ready to go. But then the next time you're like, I don't care if you're not ready, you need to get in the car, we need to go. And either you're gonna walk or I'm gonna pick you up and we're heading out the door. Right? That lack of consistency tells them if I throw a temper tantrum, maybe I'll get my way. And then it reinforces this idea that if I cry, I'll get my way. But then the parent is like, stop crying. Don't cry. How do you not know how to use your words? Why are you even crying? Why can't you listen? It's
frustrated, yeah.
Consistency also matters. I'm like, yeah, okay, it's fair. I mean, sometimes being consistent is hard. I'm not a parent, and I know that it is hard as hell to be consistent when you have the capacity one day, when you don't the other day, when you're on a schedule one day, when you're just kind of relaxed another day. But it's important to know this, right? Consistency matters. And I'll give you one like really specific example that I actually saw recently that I was super shocked by. The kids and the parent kind of like roughhousing, like the dad and the kids like roughhousing, just kind of like fake karate punching and like whatever, right? They were roughhousing and the dad was also participating in like kind of fake punching them and the kids were like real punching them. They don't know how to fake punch, right? They were kind of punching, but they're little kids. They're not really making much impact here. So that's kind of like normalized, right? Like when you see that happen, your dad like just kind of roughhouses with you. You're really young. You don't really know like the impact of your power.
Yeah.
You kind of think, oh, this is just something funny that we do. This is fun. This is nice. But what happened was we all went to go, we went somewhere. I think we were getting ice cream or something. And then she got upset about something. And then I don't know if she punched him or she kicked him, her dad. And then the mom and the dad were like, what are you doing? They kind of like yelled at her. They like scolded her in front of everybody. And then she got really quiet and sad. But in my head, I was thinking, what did you expect? You haven't taught her when this is appropriate and when this is not appropriate. You haven't told her what is playful roughhousing and when that's disrespectful.
Yeah.
That was not modeled. That was not even verbalized. Nothing. So how do you expect a kid to know that? They're not gonna. And then to scold them, now they're going to be super confused and be like, what's happening? Why am I getting scolded right now? Right? So I just feel like it's so easy for parents to sometimes forget, like their kids are literally almost, not exactly, but like kind of like blank slates.
They are.
You're
They
teaching
are.
them what is and
Yeah.
isn't okay. And if you don't teach them something, they're just not going to know it.
And sometimes, like, parents don't teach because they think they can't understand, but that's a
Yeah.
really big misconception. Like, kids can understand distinctions and
From really young.
differences. Yeah, like, they
Totally.
just need to be explained in ways and words that they can understand, like simplified
Yeah,
explanations. But that's
exactly.
such a common misconception that I see all the time is like, oh, like,
Yeah.
you don't need to teach the child about their diagnosis or their treatment because they're too young. They're not going to
They
understand.
won't get
But
it.
that's not
Yeah.
true. I've had kids as young as like 2 have some form of like teaching that can be done,
Yeah.
you know?
Yeah. Exactly. Exactly. I think that's a great point too, because like I think I've sort of internalized that too. Like growing up, I always was I grew up a lot with younger cousins. I was always the oldest. So
Hmm.
I operated on the same thing because that's what was told to me, right? Like earlier I
Yeah.
said, this isn't a topic for kids. You're too young to understand. And so like I genuinely was like, oh, okay, I guess maybe I am missing something, right? Maybe kids just don't know. Right. So when I was basically as the only older child, I was
Hmm.
always taking care of the little ones. And like I liked it. I enjoyed it. I love babies. They were cute. It was fine. But I would literally do everything for them. I'd be like, "Oh no, you don't need to get this. Let me help you carry it. Oh no, you don't need to help me do this. Let me do this for you." And
Hmm.
like I've been recently learning how I follow a couple of these like recent quote unquote new age moms, that do parenting from like a very gentle parenting, which is,
Hmm.
another word for what was it? Authoritative parenting,
Hmm. Hmm.
right? And what I discovered that was so shocking to me is that kids as young as like 1 year, even year and a half, maybe. I don't know exactly the age. I think it's like a year and a half. Even as
Hmm.
young as that, they can actually help with something in the kitchen, right? Like
Hmm.
even if that's
Hmm.
just helping you measure things and like just dropping the
Yeah.
spoon thing, even if that's picking up something and giving it to you, handing it to you, just like whatever little things, if you
Yeah.
involve them early on, it teaches them competence, it teaches them responsibility, it teaches them
Hmm.
to feel like confident even, right?
Yes. Lots of
But that was like a
empowerment. That's,
mind-blowing thing for me
yeah. No,
to
like kids
see.
need empowerment, like you said.
Yeah,
That's how they
yeah.
build their
It's
self-esteem and
great for
confidence.
self-esteem. It's amazing for their self-esteem. And it was so
Hmm.
shocking to me to see like this mom's like 3-year-old boys just like cutting and making their own breakfast. Like even if it's like
Oh,
cutting like the bananas and putting it in their cereal or like whatever. And I was like, whoa,
that's
is that
awesome.
safe? Is that okay? And I was just like blown away by it. And like I was so amazed by their ability. And it's like I never would have
Yeah.
thought or guessed that, yeah, kids are totally capable of doing that.
They
They might be
are very
clumsy, but that's
capable.
like super cute. Let them be
But
clumsy.
that's how
Let
they
them not
learn. They'll
stumble.
learn through their clumsy mistakes. Let them be clumsy.
Exactly.
Let them make mistakes.
The other big thing was, I think this video actually went viral of hers. I wish I could remember her name to share, but this video went viral where her son, really young son, knocked over, I think, a iced coffee drink or something.
Oh, I think I've
And she
seen
went,
this video.
okay, yeah, see, it went viral. And she went, but she didn't do anything. She just kind of took a deep breath and then she just kind of said, oh, he dropped this over. What are we going to do? And he goes, clean it? And she's like, yeah, we need some help. And they kind of cleaned it together. And she was talking about how, like, as a girl, like a young girl herself, she's been yelled at so many times and made to believe that it's like her fault and like, why would you even do that? Like, can't you be more careful? Why are you so clumsy? And like, shaming versus
Yeah.
she was talking about how healing it was to kind of show her son mistakes happen. But what are we going to do now? Like problem solving
Mm-hmm.
skills, and
Mm-hmm.
like
Yeah.
taking away this unnecessary shame of you made a mistake. Big deal. Everybody makes mistakes, right?
Yeah.
That could literally have happened to her as an adult. She could have
Yeah.
dropped that easily just as he did, right?
Yeah. And I think it's like removing the emotional reaction or emotions from it. Like you might have, as a mom, like you might have a long day, you're frustrated, like you want to get things moving, and your child drops that milk, and you're like, oh, like let me just do it. But
Yeah,
like that's what you need to remove, right? Like
yeah,
take away the emotional reaction, take away the
yeah,
emotion reaction, the reactivity that you might feel inside. Like you said, she took a deep breath
yeah,
and she recentered and was like, what are we going to do? Like this is normal. This
yeah.
happens. Like normalize mistakes. That's
Yeah,
important.
exactly. Yeah. You take away any negative connotation and you just kind of think
Hmm.
about, well, what do I need to do now then? What's in my
Yeah.
control here? Yeah.
Yeah.
I love that. And that's such a simple yet powerful example, in my opinion, because we were actually just talking about it with, we have some new parents in the family, and we were just talking about that with them when they were still pregnant and they hadn't had their child yet. And they were saying, I think the conversation is like, how would you respond to that? And they were saying like, oh, you wouldn't hit your kid if they did that. And I was like, you would hit your kid if they spilled milk? Like, that's not their fault though. They didn't mean to though. It's not like, I mean, if they purposefully did it, like, okay, maybe they need a timeout, they need an actual, some kind of punishment, correction, blah, blah, blah. But if it's an accident, you would hit them? Really? Mm-hmm. I don't know. I think there's still a lot of people that probably think that way, you know, even in this day and age, but there is another way, folks.
Right? Yeah. And maybe some people might say like, oh, they won't learn that spilling milk is wrong until we correct them or punish them. But the counter argument to that I read and like seen videos about too is they will learn through natural consequences when they have to problem solve, right? Like, oh, I spilled this milk. My time to make the cereal is delayed. But I have to clean this up now, right? The natural consequences tend to
or you don't get it. Teach. Like if you drop something that they got from outside, maybe you're not going to go get it again. You dropped it. It's done. Mm-hmm. But yeah, natural consequences. You have to clean it up. You have to clean that up.
Yeah.
Nobody wants to clean things. Nobody likes that. But, you know, at the same time, too, the people who, you know, think like, well, this is how they learn. I think it's really important to recognize what's actually being learned. What they're learning is not necessarily that I shouldn't drop this. Yeah, maybe that's partial takeaway. But what they're really taking away is it's not okay to make mistakes. And when somebody makes mistakes, you need to yell at them to correct their behavior. You're teaching them aggression. You're teaching them
mistakes are bad.
They're not allowed to make mistakes, that it's shameful, that it's in their control, which is just, all of that is just not true.
Yeah, exactly.
I'm very passionate about this, in case you couldn't tell.
Yeah, I could tell.
Lastly, all I really want to say is I think as I was reflecting through all of this, like I've never really sat down and really truly thought about these expectations, but I think the biggest takeaway for me as I've been reflecting on all of this for our episode today is simply that kids are always watching you, and what you say to them and how you model it together combined is so impactful.
It is.
So be aware of what exactly you're imparting to them.
Yeah. Yeah. And sometimes the expectations that you set for yourself are also modeled. Like, you know, like how you react to your own expectations or how you react to your own failures. Like, what are you modeling? How are you modeling that?
Yeah.
Right.
Yeah, exactly. I really do feel like, Abby and I were just talking about this the other day. We were saying like, it would be really important, really cool if everybody that had a baby was kind of required to take like a free course on how to be an effective parent, what to expect, how to be yourself and take care of them.
Yeah. And I would say like, unfortunately, like a lot of this work is not just, I would say like, it's what course would be helpful, but like a lot of it is like working through your own reactions and emotions, which can take some time. Right. Like, I'm sure like that mom that went viral, like in order for her not to react emotionally like that was probably not an easy change or easy fix.
She's gone through therapy for sure. She's healed her past stuff so that she doesn't react this way.
So it should be recommended that before you become parents, you
do a little inner work. Do a little inner work. Do a little bit of parenting classes.
Yes. There you go. There you go.
Yeah, there's a whole preparation. Okay, this is not just a advocate. There's a preparation here. Yeah. Well, shall we wrap up then today?
Yeah. No, I appreciate you sharing your story and your experience and your reflection. I think I like the take that you did on it. Like it was a little different than mine, which is always nice. We have different perspectives on our episodes.
I love that. It's like a holistic, well-rounded.
Yes. And the examples you gave are really spot on. And I feel like it could resonate. A lot of our listeners have resonated with me. So thank you for sharing.
Of course, darling. Thank you for sharing. A lot of love to give.
Yes.
All right, let's wrap up. As always, if our podcast has resonated with you, you'd like to share your story with us, or maybe just ask us some questions, give us some advice on what topics you want to hear from us, you know, whatnot. Please reach out to us at talksthathasiontome@gmail.com, or you can find us on all the socials at the handle @talksthathasiontome.
Right,
See you next episode.